I'm Mariana Arcaya, and I'm a social epidemiologist and an urban planner. I did my doctorate at the School of Public Health at Harvard, the Harvard T.H. Chan School of Public Health, and I did my MCP at DUSP. I'm an assistant professor of urban planning and public health, and I'm affiliated with the Environmental Policy and Planning Group and the Housing, Community, and Economic Development Group at DUSP. And I see my work as bridging across different schools at MIT by collaborating with researchers where we all share the same goal of improving human health. And I know this has been one of the priority areas for the Institute over the next couple of years. So there are connections to folks in architecture who are looking at how do we improve the indoor air environment, built environments to improve health, folks in the economics department who are looking at more health policy questions, folks in the media lab who are looking at behavioral nudges that can be made through the environment to improve health, folks in Sloan who are also looking at some health policy questions, and anthropology is starting a global health minor that looks at sort of medical humanities and our changing perceptions of health and disease. And so I think my work relates to a bunch of those efforts across the Institute. I tell students that are interested in health that while a lot of the methods for understanding health problems can be found in epidemiology and other public health disciplines, that the toolkit for solving these problems often comes from planning. And so when we think about some of the major chronic diseases that are facing the country right now, these are often diseases of physical inactivity and poor diet, and we know that our built environment and our socioeconomic environment help shape our access to opportunities to be physically active, our opportunities to buy healthy, affordable, fresh foods. And so there's been a lot of work done on the built environment and the food environment for health promotion. And I say even more than that, the economic democracy work that this department does is incredibly relevant for the social determinants of health. A lot of the health problems that we see are not just about low levels of health or high levels of disease, but also about social inequities in disease. And so what we observe is that people who have more economic resources, more economic opportunity, more education, who live in higher resource neighborhoods will do better on almost every health outcome that we look at. And so I think that any efforts that we can make to improve socioeconomic equity and equity in the types of opportunities we encounter in our neighborhoods is actually public health promotion strategy. And so I tell students you can learn a lot about disease and you can learn a lot how to create statistics of health and disease from public health schools, but you really learn how to solve problems in a school of architecture and planning.